if you're gonna shoot from over there, I gotta suck my stomach out all the time. There's no way I can hold my stomach in and think. Now I'm all confused. Now I'm all fussy.
Protect your back.
Protect your back. Body mechanics. Okay. It amazes me personally all the time when I ask an 80-year-old woman or man to sit up and on the edge of the bed, and they do this number. They sit up like this, and then they spin their feet over. And to me, every time I do that, I say, oh, that hurts my back. So watch her again. Lay down, just sit straight up like in a long sit. See how much work she has to do through her abdominals and her hips, and then why do I have back pain? Well, I know one of the reasons. There's probably lots of reasons. So go ahead and lay down. We like to teach our people to go through sideline to get to sit 99% of the time. There are exceptions. Some of our hip replacement people can't roll. Some of our spinal cord injury patients aren't. That's not going to be their most effective way to get up. But most of the time we would prefer you log roll. And so we tell people we want our spine to be in a line. We want it to stay in a line. So how am I best going to do that? I'm going to bend the opposite knee up. So I'm going to ask you to bend your opposite knee up. I'm going to ask you to reach with this hand towards here while you push with that leg to roll to your side. So you're going to reach and roll, and now you're going to kick your feet off. Now you're going to push your elbow with your elbow in your hand to sit up. So we've gotten her up without twisting her back, without rotating her back. So especially for our back pain patients and all those, I tell people this is how everybody should get up. It's just not how everybody gets up. Same thing for going back down. I would prefer them to go through sideline. So I tell them put a hand down, lower yourself down, put your shoulder on the ground, and put your feet up, and roll yourself back over. So if they go into that kind of, we learn hook line and half hook line, right? So here's hook line. We were in long sit, and we were over here with the legs off the edge. We're in short sitting. Okay, so we come back down. To get her to roll to her side, I can either ask her to go into hook line or to just bring one leg up, and I would call that half hook line, even though I think I just made that up. And if you push with that foot, you don't rotate as much. So I'll put that on my list with Lita's. The one I made up for Lita last week. What was that?
The petticoat junction.
Junction, yeah.
Oh, yeah.
I made that one up too. So I'm going to start anew. I made up therapize too. I tell people I therapize all the time. All right, so hook line to get up. Most of the time we want them to push and reach. The reason that's important to reach, how many times can you go lay up and sit up and lay down? Is that especially when I start getting weak on one side, this arm gets weak and this arm can't reach and push, and people won't be able to roll themselves over. And it's usually because this arm is over here and they're not paying attention to it. So if they're a stroke, sometimes they have to teach them to reach and grab their arm and bring it up here and push with this leg and reach with both arms. Sometimes I just have to remind them, you know what, that opposite arm has to be over here or you're not going to get up. And it does make a difference. If you were to try to just roll over like that, as opposed to going ahead and just bringing your arm across your body, then bring your arm across your body. Now roll, push with your leg, and you come right over. Okay, and then if they push with that down elbow, it's going to be the easiest. All right, so that's rolling the side leg.
And they can do it with both knees bent as well.
You could do it in hook line, yeah. Bring them both up and bring them across. If I'm teaching it, I'll teach you this in spinal cord class. If I'm trying to make it easier for you or to teach you how to roll, that's what I'll usually do is I'll bring them both up and I'll actually help a little bit. Where's a great place for me to help you roll? Right here. Okay, so completely relax your body as much as you can. Okay, so I put this hand here, I put this hand here. I can get you 3/4 of the way rolled over. I get this hand over here. You're 90% rolled over and you didn't even have to do anything. I did very little work. Right, and I didn't touch your neck or pull on your arm, because I'm never, ever, 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 under any circumstances, going to pull on someone's arm to transfer or to roll them. Okay?
That held my back.
Yeah, well, you can dislocate somebody's shoulder if they're weak here. How does your arm stay attached to your body? What's keeping it attached to your body?
Muscles and
skin. How many people can name one ligament in your knee? ACL, PCL,
PCL,
right?
MCL.
ACL, PCL, MCL, LCL. So there's at least 4, right? How many can name a ligament in your shoulder?
Nope.
Yeah, but that's muscle.
That's
Right.
why they said to stop swinging like little kids from there.
Yeah, that's my mom's like, don't ever pick a kid up, I don't know, you can this guy.
Okay, so my knee, great stability, lots of ligaments. I got 2 motions, right? For our consideration right now, I have 2 motions, extension and flexion. How many motions do I have on my shoulder? Well, we count
Like
4, 5, 6 of them, right? You add in scapular rotation, you've got even more. So you're giving up stability to gain mobility, which means now when my muscles are paralyzed, my arm just hangs there. You'll actually see people where you can put 1 and 2 and 3 fingers between the head of their humerus and the bottom of their clavicle here, their AC joint.
Stays like
From
that.
it's just separated, just from the weight of your arm. Your arm weighs 10 pounds or so. Mine probably only weighs 3, but you know, if you were big and burly like Renee, it'd probably be like 12 pounds. Just the weight of your arm will start to dislocate your shoulders. So if I roll in here and grab a hold of it and go like this, there's nothing holding that thing together but paralyzed muscles. I can actually dislocate your shoulder. So I'm never, ever, 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 right? And like I said, you know, I got her most of the way rolled over here without even touching her. So now I'm going to grab the shoulder blade to help her finish rolling over if she can't help